Hello, everybody. I welcome you all in another episode of Ask Me Anything session, episode number 106. And today I welcome Dr. Geeta Sinha on our show, who is very senior gynecologist. So today we have topic how to have a healthy pregnancy, and she will educate us on that. After that, she will entertain the questions of our users. So,
Hello,
ma'am,
ladies. Good evening, ladies. I'm Dr. Geeta Sinha We are going to discuss on how to get a healthy baby and how many times we do the antenatal checkup by the doctor and what is antenatal checkup. The actually, the antenatal checkup is time to time we you meet your doctor so that the doctor will detect any complication and what is the growth of the baby and what to do or not to do. So definition of antenatal is systematic supervision of the woman during pregnancy, and that is called antenatal care. The pregnancy is of 9 months and it is divided into 3 trimesters. Each one has 3 months. What is the aim of antenatal? Why we do antenatal? The aim is to achieve at the end of the pregnancy a healthy mother, a healthy baby, and this care begins soon after conception and continue throughout the pregnancy. Then what we have to do, what you have to do also, the you first register to nearest health facility as soon as pregnancy is detected. And 4 antenatal checkups are essential for the antenatal woman. First, an ANC checkup as soon as the period is missed or within first 3 months of the missing the period. Second, antenatal checkup in 4 to 6 months of pregnancy, and the third ANC checkup in 7 to 8 months of pregnancy. Fourth, antenatal checkup of 9 months of the pregnancy. Regular ANC visits protect you and your baby from complications and ensures the healthy mothers and child. So, antenatal checkup, what we can do there? We will go first, we will register ourselves, get our hemoglobin, blood pressure, urine, weight, abdomen checkup, and every visit. Ensure that you have you have no complications and your antenatal checkup is going on and going on very nicely. So you will go to when it is already 3 months. We will when you detect that you have pregnant, first you go to your doctor and doctor will start folic acid for you. The folic acid is very essential so that the baby will not have any congenital anomalies, and you will go for the regular checkup of your all blood and urine and checkup of hormones is done on that time. The essential is hemoglobin and urine is must done on that day. Thyroid, glucose tolerance tests are also very essential. Then when there is 3 months, we start the tetanus toxoid injection of 1 month interval. There are 2 injections are for the ladies. For complete 9 months, we give 2 tetanus toxoid injection. During pregnancy, the 100 tablets of iron and folic acid will be given. 1 tablet of iron folic acid is taken daily, starting from the 4th month of pregnancy. If you are anemic, you will be advised to take 2 iron folic acid tablets daily. The diet during pregnancy is very essential. The 3 things, the diet, the rest, and the medication, is very essential for the development of the good health and healthy baby. The medication is nothing. It is iron folic acid tablets to improve your hemoglobin. That is to improve your hemoglobin and the nutrition to your baby. Time to time, we educate that how much you have to eat and how much rest you have to take. The need of the to eat one extra meal a day during pregnancy is needed. If people are eating, your husband is eating 4 meal, you have to take 5 meal, one extra meal. Take milk, dairy products like curd, buttermilk, paneer. These are rich in calcium, protein, and vitamins. Each fresh seasoned fruit and vegetables are these provided vitamins and iron. Cereals, who gain and pulses, grains and pulses are good sources of protein. Green leafy vegetables are the rich source of iron and folic acid. The handful, 45 grams of the nuts, and at least 2 cups of the dal provide daily requirement of protein in vegetables. For non-vegetarians, meat, egg, chicken, and fish are good source of protein, vitamins, and iron. The bowel care is also essential to avoid constipation so that you will not strain yourself. Regular diet, taking plenty of fluid, vegetables, and milk and roughage is the good source to clear the bowel. So take milk in the evening, some one glass of milk in the evening, little chana in the morning, some green leafy vegetables, and don't take out the chilka from the vegetables. Only wash them properly, make them so that the roughness will be there and your bowel will move nicely. The cleanness is very essential. Wash your hands with soap and water before every meal and after attending toilet. Clean your nails, clean your hair, clean your body carefully. Comfortable cotton garments that are very essential. Avoid high heels and belts on the tummy is not appreciated. So should be loose. Clothes should be loose. Your slippers are not high heeled. It should be flat and very comfortable. Dental care is also essential. Don't take out the or prick your daat, the dental. I mean to say, don't handle roughly to your teeth so that you will not injure them. The gums are very, very tender that time. During pregnancy, the gums are sometimes very little swollen. They bleed on if you roughly brush them. So very gentle with your teeth also. Breast engorgement may cause, your breast should be taken carefully. Breast engorgement may cause discomfort during the late pregnancy. A well fitted brassiere can give an relief. Sleep is very essential. Sleeping during pregnancy, at least 2 hours sleep in the day and 8 hours sleep in the night is very essential. A lady should not sleep on her back up. She should sleep right or left lateral position. Should not sleep supine position, and that will give some complications to the baby. The supply of the baby could be hampered if the body the cord will compress. You will lie down straight. N- should be in lateral position. Lateral position is always good, and do some exercise. Exercise is not heavy exercise, and strenuous exercise is not recommended. Very gentle exercise. You can walk 20 to 25 minutes every day, in the evening, morning. You can do breathing exercise in the open air, and some few exercise which is recommended. You can uh, get this teaching in your antenatal clinic. Then we come to the coitus. Coitus means uh, physical relation with husband. Contact with the husband to be avoided during the first trimester of the last 6 weeks. First trimester and last 6 weeks. Generally, last 6 weeks means third trimesters, 8 to 9 months, half of the 8 months and 9 months. Generally, the coitus is not restricted during pregnancy. The release of prostaglandin and oxytocin causes due to coitus causes sometimes uterine contraction. That is why the very gentle relationship is recommended. The woman with increased risk of miscarriage and preterm labor should avoid coitus if they feel such increased uterine activity. There is a cramp, there is a discharge, there is something hardness, then please avoid this. Traveling. Traveling by vehicles having jerk is better to avoid it, especially in the first trimester and the last trimester. The long journey is preferably to be limited to the second trimester. Rail route is preferable to the bus route. Travel in pressurized aircraft is safe up to the 36 weeks only. 36, I think it is recommended by the airways only 33 weeks, but 36, if it is nothing, no adversity, you can travel up to 36 weeks. Air travel is contraindicated in the cases with placenta previa, preeclampsia, severe anemia, sickle cell anemia. Prolonged sitting in the car and aeroplanes should be avoided during the risk of venous stasis and thromboembolism. When you have a engorgement of veins in your leg, and there is a pain in the leg, then it should be avoided. Prolonged aeroplane and prolonged sitting is avoided. Smoking, alcohol, and drugs, these are prohibited in the pregnancy. It causes severe harm to the baby and to the mother also that time. The family support, your family is supporting you, and the husband and mother-in-law gives emotional support and confidence to you, then your path of the childbearing is very easy. The family behavior attitude should be pleasant and encouraging. Families should ensure provision of healthy diet and timely visit to the health facility. Avoid delay in contracting medical facility when labor starts or in case of complications. The delay will always make you land up in complications. If bleeding starts, if pain starts, if discharge starts, if you have severe headache, if you have this heartburn, if you have anything which is not natural day by in day to day life, you must go to your medical doctor. If you go to doctor, and you should not delay, because these are the signs which gives that you must go to the doctor. If you will delay, something adverse could happen. We can today I can say the severe pain in abdomen. What is the signals during pregnancy which say that you rush to the hospital? Severe pain in abdomen, generalized weakness, easy fatigability, breathlessness, excessive swelling in your legs, bleeding per vaginum, convulsions, fever. They are dangerous signals during pregnancy. This these signals gives that you have to go to your hospital very fast, very urgently. You have to meet your doctor. And these are all the things which the antenatal checkup gives you, and detect from you that you are healthy. You will finish your antenatal 9 months nicely if you will go to your doctor in first trimester, second trimester, and third trimester according to her advice. You follow it and get a healthy baby. Thank you for patient hearing. Thank you, ladies.
Th- Thanks a lot, doctor, for such a detailed and wonderful information. It's time to take the questions now. So let's start it.
1 minute. 1 minute. May I take 1 minute only? 1 minute only. Okay.
Sure, doctor. Sure.
Okay. Thank you. Please. Please.
Yes, doctor. So
Please.
our first question is from Abusha. She's asking, is amniotic fluid get thick in last weeks of pregnancy as she is 39 weeks, 4 days pregnant, and doctor has said that amniotic fluid become thick. So what is the reason behind this and can there be any complication?
Yeah. Amniotic fluid. What it does? Amniotic fluid gives a so that baby floats in amniotic fluid, and the amniotic fluid is it gives a sign of healthy baby. And different um, different trimester there is a different measurement of amniotic fluid. So in the last trimester, if you have less amniotic fluid, less than the recommended measurement, then it is dangerous. If doctor says it is optimum, your amniotic fluid is okay. Thickness is nothing. Its measurement is essential. Amniotic fluid index is essential. If it is an optimum, there is no need of worry. But if it is less than optimum, then you have to go, and your doctor will suggest whether to deliver, when to deliver the baby. Okay.
Thanks a lot, doctor.
Thank you.
Our next question is from Moni. She's asking, in first trimester, shall we apply any hair mask like methi leaves with curd like that?
Mask. Mask
Yeah,
is not
hair
going to
mask.
do anything, but this is curd is nothing. You can apply. Methi, I don't know, because methi sometimes causes some skin infection in rashes. So curd is okay. You can apply curd, no problem.
Thank you, doctor. Next question is from Sana. She's asking, her hemoglobin is 12.3 and thyroid TSH is 6.4. Her all reports are normal and she is trying conceiving pregnancy for 4 months but not getting any success. So she is asking, like, what is it happening? Like, why is it happening, or
Can
what
you
should?
repeat the question again, please? Can you
Yeah,
repeat the question again, please? Yeah,
yes,
yeah,
doctor.
please.
So
Yes.
Miss Sana is there. She is asking, like, her hemoglobin is 12.3 and
Mm-hmm.
thyroid TSH is 6.4.
Mm-hmm.
Her all
Mm-hmm.
reports are normal. So she
Mm-hmm.
is trying conceiving for last 4 months, but she's not getting any success. So
How
she's
long she is
asking,
married? How long she is married?
okay,
Only
Miss
four
Sana, if
months.
you no no
If
don't
it
know,
is
doctor.
Acha, okay, 4 months is very little time. So you have to try for a little longer. And your thyroid profile is high. So please contact your infertility expert so that she will give, or endocrinologist. He will give your, or she will give you the control of thyroid.
Thank you, doctor.
For that control of thyroid. Thyroid is a very, I mean to say, very notorious hormone. It affects the fertility, it affects the fertility, menstrual cycle, and reproductive system of the ladies. So please contact your endocrinologist so that he will control your thyroid function, and then maybe you will get in other 3 to 4 months your baby. The only infertility is a long chapter. All the parameters are okay, but still the relation is also very important. If your time to time, the time is fixed, the during the ovulation, if you have relation, then you may get the pregnancy. Otherwise, relation in between ovulation is not going to give a fruitful pregnancy, fruitful the relationship.
Thank
Hello.
you, Doctor. Our next question is from Miss Alicia. She's 18
Excuse
weeks
me, I
pregnant.
cannot hear you. Hello.
Hello,
Pooja, I can't hear you.
Doctor,
Pooja,
am
I
I
can't.
audible?
Pooja, I can't hear you. Hello. I can't hear you.
Hello, Doctor. Am I
Pooja,
audible
I
now?
can't hear you. Ah, yes. It was muted. So please repeat the question.
Yes, Doctor. So our next question is from Alicia. She's 18 weeks pregnant and she's having problem of severe hair fall. So can you suggest her something for this?
First thing, if she's using a strong, hard shampoo, she should change it. First thing. Second, the nutrition is very essential. You take spinach, and hemoglobin level should be optimum. Otherwise, your hair will fall. So please take spinach, green vegetables, high protein diet, and rest also. Thank you.
Thank you, Doctor. Our next question is
Next.
from Chester. She's in 15th weeks of pregnancy and from past few days she is experiencing mild lower abdomen and lower back pain. So pain comes and goes and also she feels sleepy full day. So what can she do?
This is very natural because sleeping. This is due to hormonal changes. You feel sleepy, but cramps, cramps. Please, for the cramps, you have to meet your doctor because sometimes cramps leads to threatened abortion. So it is very essential. Go to the doctor and get a proper treatment. Thank you.
Thank you, doctor. Next question is from Ayushi. She's in her 19th weeks of pregnancy and experiencing no fetal movements. So how and till when can she experience the movements?
After one uh, 10 to 15 days, if she will wait, she will have start, the movement will start because usually the in primary 20th week is the right time for the movement, and she is in 18 weeks only, na 19 weeks. You said 19 weeks or 20
Right,
weeks?
doctor.
How much you said? Hello, Pooja.
19 weeks. 19 weeks, doctor.
Pooja,
Hello.
you said 19 weeks, na?
Yes, doctor.
19 weeks pregnancy. So after 20 weeks she will get her movements, and beforehand she should go for the ultrasonography. This is the time for anomaly scan. This is the time for anomaly scan. 19 to 20 weeks she should go for the anomaly scan, and she will get the answer whether the baby is good, why not moving. Movement mothers percept after 20 weeks in primary. Few mothers may percept earlier also. Thank you.
Thank you, doctor. Our next question is from Priyanka. She is in her 26th weeks of pregnancy. Uh, okay, sorry. On May 26th, she had normal delivery and she had stitches. So, from when can she start doing exercises to get rid of tummy? And she got her period in July 3rd. Is it normal to get so early, even she is breastfeeding?
Sometimes it is early, and that is good also, that your the cycle is regularized and you can know that nothing is adverse. But if it is a prolonged bleeding, it excessive bleeding, then it is alarming. So then you have to take advice from the doctor. The second thing, when the stitches is there, at least 3 months you have to wait, and afterwards the walking is the best exercise in this time. Brisk walking after 3 months. Walking, normal walking, you can do now also. There is nothing adverse in it. Thank you.
Thank you, doctor. Our next question is from Anand. Hi, ma'am. I am 19 weeks pregnant. I have swollen leg since 2 3 days, and one hand is feeling little numb since a week. My vitamin B12 is 195 and vitamin D 9.65. Is it because of low vitamins?
Yeah, it is. Always it is. But swollen legs are sometimes due to hemoglobin, thyroid, and if you have albumin in urine. So please go for the checkup. All the parameters, the hemoglobin, thyroid function, and urine albumin. Vitamin D also is very essential. Go to the sun in the morning around 10 to 11 for 20 to 22 minutes, so that we will get the vitamin D from the sun also. Thank you.
Thank you, doctor. Next question is from Kirthana. Hi, ma'am. I am 19-week pregnant. I know the baby movements below the belly button. Is it normal? In 16th
Please.
week scanning, in 16th
16
week
weeks.
scanning, her doctor told her that she has low-lying placenta.
That is a different issue. But movement of baby, one can percept after 18 weeks, 16 to 20 weeks, anytime. Some multigravida can percept 16 weeks, and primi 19 weeks, 18 weeks, 20 weeks. It could be no problem. It's good. But low-lying placenta it means the placenta is near the opening of your uterus, that is cervix, neck of your uterus. So you should not do the strenuous work. Do not lift heavy things. Do not this what you say, पोछा करना, जमीन का कोई काम ना करे. You know. So take precautions so that you will not should not get bleeding, because placenta is a organ which supply to the baby, and it is when it is if you any trauma on this placenta, the bleeding could start. So please take care. Thank you.
Thank you, doctor. Our next question is from Anusha. She is 12 weeks, 4 days pregnant, and she's asking how to increase her hemoglobin because this is her third delivery. And in first two deliveries, she had C-section and had 2 times injections to increase hemoglobin, but she doesn't want
See,
it.
okay, so you have plenty of time. First, go for take green vegetables. The vegetables and fruits and nuts, those who are those has plenty of iron in it. The deficiency of iron is one of the cause of a low hemoglobin. So please take care. What are you eating? How overcooked foods spoils the overcooking of the food spoils the ingredient of it. So it should be taken care that it should not be overcooked. The spinach should be taken every day. Munga, we say munga. There is a leafy that is also sag. Munga ka sag, we say that is a rich source of iron, and rich source of iron is khajur, uh, banana, say apple, khajur. Uh, these things are full of spinach is the best. Is things full of iron. So take iron, um, high iron products, and go for deworm yourself also. A time to time checkup of your HB hemoglobin gives you the idea whether you have to take more medications or more precaution to increase your hemoglobin before end of the pregnancy, third trimester. You must increase your hemoglobin level up to 12, or if it is not possible, at least 11. So mm, so that you cannot you will I mean, to protect yourself, to taking blood and IV medications, all this. So take iron tablets, folic acid tablet, rich diet of hemoglobin contains diet, and deworm yourself. That's all. Thank you.
Thanks a lot, doctor. Our next question
Thank you,
is
Pooja.
from Pooja. Okay, she is in her 26th week of pregnancy and she has excess fluid. Her double marker test, NT scan, and anomaly scan is normal. Also, her sugar reports are normal. So, she is asking what else can be the reason for this, and can this be a cause of preterm delivery?
Your blood sugar is okay? Do you have any history of blood sugar in your family? And this is your first pregnancy, probably. Is it your? She is primary. Pooja, is she primary? Pooja,
Yes, doctor. If you are
she is
listening,
primary, na?
Pooja Kokil,
Because
then
she
please
says me.
reply to. Yeah.
Is she primary? Okay.
Don't know,
If she
doctor.
is
She has
primary,
given.
okay. So sugar reports are also normal. Sugar reports are random, or OZTT has done, or challenge test has done or not. If she has any history of family history of sugar or not, and sometimes there is anomaly scan is okay, everything is okay. So there is unknown factors also. Hemoglobin is okay or not. These are few factors which causes polyhydramnios, because and there is no anomaly, so that excluded. Her hemoglobin is okay or not. If she has
Uh,
any infection, all these should be excluded. Then you can go to your doctor to ask this question again and again, because here we cannot tell you the perfect answer. Because you are saying everything is okay, there must be something somewhere. Maybe hemoglobin is
doctor,
low.
she has
Yes.
mentioned that she has no history, and last time she had TGA.
No, last time had.
Yeah, she had TGA last time. Otherwise, she has no history, as you have asked.
Yes. So that is why I'm saying the close observation is needed, because from here it is difficult to say, please, if everything was okay, then why she should have this? Must be hemoglobin must be low. I am thinking so. She should go for the re-evaluation. Thank you.
Sure, doctor. Thank you. Next question is from Sujata. She is in her early pregnancy and doctor has prescribed her Nutricell and progesterone tablets. So can she use them and how to take care?
So doctors must be thinking that you maybe your hormonal profile is low. That is why she has given you the this progesterone. You can take it. Progesterone causes stops the threatening of the pregnancy, and it quieten the uterine contractions. So good, take it. That's not a bad thing, which has prescribed to you. It is good. Thank you.
Thank you, doctor. Next is from Malik Arjun. Hello, ma'am. I am 12 weeks pregnant. Can use fenugreek leaves paste to hair? And does it leads to miscarriage? Some person scared me about this. Please tell me, is it okay?
Uh, See, fenugreek. But why are you want to? Why do you want to put fenugreek leaf in your hair? It's very good. So suggest us. During pregnancy, we don't want anything which is not established their function and property. If you don't, we don't know their property, we should not use it during pregnancy. Fenugreek is good for the shredding your weight and fat, but I never heard that fenugreek is good for hair or anything else. I don't know. Actually, this should be not. This is not a question for this session. Okay, thank you.
Thank you, doctor. Next question is from Sai Shri. Hello, ma'am. I'm pregnant with seventh month. Is it possible to manage my pregnancy without calcium and iron tablets, as I'm including calcium and iron rich diet naturally?
If you are taking that only and no iron calcium, then go for screening time to time. Maybe every month screening, not in the end of the pregnancy, before. Because people cannot eat that time nicely. Even in normal non-pregnant stage, you eat properly, but in the pregnancy stage, the appetite goes. You take food less, you cannot take, you are very choosy, take few things. If you are not choosy, you are taking everything properly, then go for screening. If hemoglobin is okay up to 12, your calcium is okay, then you can avoid calcium and iron tablet. But I think it is not possible without iron calcium tablet, that growth of the baby and your uh, hemoglobin and calcium level is will be okay. So please go for screening first, then we can discuss whether you have to take how much iron and folic acid and how much calcium. Maybe it is reduced, dose we will reduce, but we cannot say without screening that we stop iron calcium. So thank you.
She's also asking, doctor, like, are pineapple, papaya, and shisham safe to eat during pregnancy?
No, 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 because it causes some placental dysfunction. This is everywhere it is written only that don't take three. It is, and there is experience that papaya and pineapple and sesame causes bleeding also. Then first trimester it is prohibited.
Thank you, doctor.
Please say no.
Sure. So our next question is from Swapnali. She's asking how to increase hemoglobin in third trimester, as she's first time pregnant and she's 37 years old, and also she has family history of sugar and
Sugar and
BP, blood pressure.
see, uh, third trimester there is a hemodilution, so hemoglobin goes down from first second trimester to third trimester. You will take 100 tablets of hemoglobin. Your you have nothing, no hemoglobinopathies. You don't have, if you don't have any digestive problem, and uh, and you are taking properly the iron rich products, then you can improve your hemoglobin up to the third trimester also. Thank you.
Thank you, doctor. Next question is from Moni. Okay, so she's 12 weeks pregnant and sometimes she's getting left side lower abdomen slightly paining and slightly vaginal pain. It's not much, just a little. Is this affecting her baby or is there any need to consult?
Yeah, there is need to consult. Maybe she is having some urinary problem, or this is just because of she is working hard, or prostaglandin releases uterus. So prostaglandin release causes cramps. Better you go for screening for the urinary infection at least. Thank you.
Thank you, doctor. Next question is from Poonam. She is asking if baby's head is down, but he is located above, as doctor said. So, is normal delivery possible in this case?
His head is down and pelvis is okay, and the head is in a normal condition, like not OP, occipito-posterior and all these. That's position of the head is okay. Then normal delivery is possible, but it is, one cannot predict it from here. The examination of the lady is very essential, and the opinion of the doctor is also very essential. So this cannot be discussed on this online education. So thank you.
Thank you, doctor. Our next question is what are the vaccinations during pregnancy, as the user is 4 months now and she has not taken any vaccine yet.
So usually we take 2 doses of tetanus toxoid in fourth month and fifth month, but nowadays there is 6 months we give Tdap vaccine, tetanus, pertussis, and diphtheria vaccine, which covers your baby up to the after delivery also. So fifth month and 6 months is good to take one tetanus toxoid, and second is Tdap vaccine. Thank you.
Thank you, doctor.
If it
Uh,
is, if you have any trauma or cut, please take it immediately.
Thank you, doctor. Our next question is from Monali. She's having 9 months now and she's asking how to prepare herself for normal delivery.
First, ask your doctor. You have your presentation is okay. If you have cephalic presentation, your pelvis is okay, and all conditions are well, then take walk, take little exercise, and the breathing exercises. That much all. There is nothing beyond that. We can predict that you will, if you will do this, then you have normal delivery. Everything is okay. Then it is not impossible to deliver vaginally, but should everything okay. Thank you.
Thank you, doctor. Next question is from Anand. She's 19 weeks pregnant and have hyperacidity. So after lunch, she had acid reflux. Even she doesn't lie down. So how can she control it naturally?
Naturally, she should not eat spicy food, mircha, and when she lie down, the her pillow should be little high. It should be from your shoulder to up, so that the reflux will be not up to the your throat. You will not acid will not reflux up. This is naturally. Or if it is, you want to more help, then take some antacids, some mm, rabiprazole, or all these PPI. Thank you.
Thank you, doctor. Our next question is from Nikita. She's 23 weeks pregnant and she's feeling period like cramps in her lower abdomen. So she's asking, is it normal?
No, no, it is not normal. Cramps, periods like cramps is not normal. She should maybe it. She is having a threatening of preterm. 26 weeks, you said, na? 26 weeks.
Uh,
I,
Doctor, it
hello,
is
Pooja. Is it
23,
26?
23.
23. So it is threatened abortion. So please she should go to her doctor and get medication, progesterone, anti-prostaglandin products and all.
Sure, doctor. Next question. Well, there's a user and she's working in IT firm, so it's get difficult for her to work. She get lot of back pain. So and she's in her fifth month also. So she's asking what can she do to avoid back pain.
Posture. First is posture. Second is plenty of water. Third is calcium rich diet. And fourth is calcium itself. If in spite of that, if she is not having relief, she should contact to her doctor. Thank you.
Sure, doctor. Uh, Doctor, as you talked about the Anand, like acidity, so they are asking further question. Like she hasn't taken any vaccine yet, so can they take them now as they are 19 weeks pregnant?
Yes, she can. She will take into uh, now. She can take anytime. If you forgot to take vaccine, you can take. So please take it. Vaccine is very essential. You have to take in 6 months. You will take 26 weeks. You will take the uh, Tdap vaccine or booster X. I mean to say it is vaccine for the diphtheria, whooping cough, and tetanus.
Thank you,
First
doctor.
dose Tetvax, second dose combination of three vaccines. Can you hear me?
Yes, doctor.
Hello.
Thank you, doctor. Doctor, there is a common query among a lot of users. They tend to feel lot of problems during sleeping at night. So they feel lot of negativity, tension, stress. So can you recommend something so that they can have a sound sleep, without any
See,
tension or stress?
meditation is the best uh, idea to get sleep. If you are relaxed, you can sleep. First thing. Second, if you have a reading habit, please start reading that time. You will get sleep naturally. Without the we say that book works like sedative. So you can read that time and sleep. First thing, meditation. Second thing, in daytime you don't sleep much. 2 hours is recommended. You will sleep 4 hours. You cannot sleep in the night. Third thing, the lack of zinc also causes lack of sleep. So zinc rich food.
Hello.
Hello,
Yes,
Pooja.
yes, yes, doctor. I,
Yeah, I'm saying it's full of zinc. Zinc deficiency causes sleepless nights. There are three, four things we have to do. Some walk. Second thing, some meditation. Third thing, read something good. And fourth thing, take zinc also. Sometimes zinc deficiency causes sleepless nights. Hello.
Thanks a lot, doctor,
Thank
for
you.
such wonderful suggestions. So we have next question from E.T. Sharma. She's 38 weeks pregnant and her hemoglobin is 10.5 and she has taken iron injection last week. So should she take any other food items at home? And from last few days she's feeling lot of contraction in night. So is everything okay?
Everything or contractions in night is, see, contractions is mild contractions always happens, but painful contractions is indicative of something. She may land up in labor. So she should go to contact her doctor first thing. Second, she asks, her iron is, I mean to say, hemoglobin is low, 10.5, and she had taken injection also. The food is, the I just now explained, there are iron rich foods are there, and iron rich foods she can take at home, like gur, jaggery, spinach, apple, banana. mm, we say khajur, I don't know, date. I mean to say date, and few more products are there. So beet also, beet is very rich of iron and supplement. It supply iron. It has a rich source of iron. So these are things she can take regularly. That's all. 10.5 is low, but due to hemodilution, because this time the blood is thin, so that causes also the I mean to say hemoglobin is what you say, uh, results low. It shows low, though it is not a actual picture. The picture comes low in spite of you have proper hemoglobin is still in third trimester. Due to hemodilution, the results comes low. It shows lower side of hemoglobin. So it's okay. Go and take in touch with your doctor. She will suggest better, because she is in close observation with you. That is the reason. You please contact her. Thank you.
Thank you, doctor. There is a question, further question, as Monali asked you, like how can she prepare herself for 9th month delivery? So she's asking, from last week she is having trouble about vomiting and loose motions. So will it affect her baby's growth? Also, doctor has given her medicine for loose motions, and also doctor has said that her sugar level is high.
Oh. See, vomiting and loose motion sometimes happens because the baby is grown up now and there is a less space in your abdomen. It presses your different gut system and different organs also. And there is a dilatation of the esophageal sphincter. There is a sphincter here, which always close in the neck, near the neck. The sphincter there. When the space is less and you eat something, there is a vomiting. Loose motion also sometimes occurs, but because of your high sugar level, please contact your doctor. 38 weeks of pregnancy is enough for the delivery. When it is high and baby is very, I mean to say, baby is very healthy and it very high weight baby has, then you have to contact your doctor, because 38 weeks is enough for a diabetic mother. Thank you.
Thank you, doctor. So here we have the last question for the session. So the question is from Meenal. She's asking, like she's having hip joint pain and back pain while turning the side. So can you please suggest her something so that she can get rid of it, as she's 20 weeks pregnant?
In only 20 weeks, she's having back pain. I think she's sitting a long time and doing something like in office work. First thing. Second thing, if she's not taking calcium, please take calcium and go to sun for some time so that you will get the vitamin D. Go for the calcium and vitamin D estimation so that you will know that whether your body has enough, an optimum calcium or vitamin D or not. If it is less, supplements should be taken. And for the back, you can apply some painkiller ointment or repellent you can take, or very gentle massage sometimes is also recommended, but very carefully, very gentle massage so that it will relieve your back pain. Thank you.
Thanks a lot, doctor, for answering all the queries of the users. Thanks a lot. It was a privilege having you on our show, doctor. We shared a lot of insights with us. So, any message for the to be mommies, doctor?
See, I always say the antenatal care is very important. Start from the first, when you miss your period, go to your doctor, and whatever she says, follow it. Food, rest, and nutrition and medication, iron preparation, folic acid, and calcium is very essential for the growth of the baby. Percept your baby. Don't use much prolonged mobile for the prolonged period. Don't use high heels. Don't use adverse things which is not natural for your day to day living. So please take care and mm, get a healthy baby. Thank you very much. Thank you.
Thanks a lot, doctor, and thank you everybody for joining us here. So we'll see you tomorrow at the same time at 6 o'clock. Till then, take care. Thanks a lot, doctor.
Thank you. Thank you, Pooja. Thank you, all moms. And thank you, baby. Thank you, Dr. Dr. Jadeep Malhotra. Thank you, everybody. Thank you, moms. Thank you.